So, good afternoon, everyone.
Good afternoon.
I am Harsha.
I'm Rehana.
And we are OET trainers working in Ajinorah. And today we will be seeing reading part C in OET. So, we'll wait for some time until our viewers are reaching into our platform. Good afternoon, Vivin sir.
Good afternoon, Sharon.
Hi, Ajmal.
Hi, Nisa.
Hi, Ajin. Good afternoon, Alga.
Good afternoon, Jisha.
Hi, Abila ma'am.
Hi, Oldina ma'am.
So today we are so much happy to be before you with this OET reading part C. So ma'am, how are you feeling today?
I'm fine, ma'am.
Okay, so today we will be dealing, as we already told, today we will be dealing with OET reading part C. So ma'am, could you please tell me about your experience while you were doing your OET about your reading?
Actually, I'm happy to share my experience in OET reading because, as you know, we have already concerned about OET reading, especially in part B and C.
Yeah.
So I'm also experienced some kind of difficulty in part B and C, but doing regular practice, I achieve some skills in OET reading part B and C. So I got a record score for OET reading.
Yeah, that's really wonderful. I hope this message will be really motivating for our candidates and viewers. And so, as ma'am told, I have also been experiencing this the same situation while I was doing my OET. So, as we all know, our candidates are always having a concern that they are feeling some difficulty in reading part B and C. So, A part is really like almost okay for them, but this B and C is having some difficulty, and it's almost true about them. Why? Because it is somewhat a complex type, but the thing is, if you are regularly practicing it and trying to achieve that required skill for that, it will be really easy for them all, and also it will be really easy for us. So as ma'am told, if you are facing any difficulty on that, try working on them, and it doesn't matter how much materials. I usually tell this to my students, that is, it doesn't matter how much materials we are doing, but whatever you are doing is try to look on it appropriately and do it properly, so you will be able to know the type of questions and the question structures very easily. I hope we are clear for you. So before proceeding to that, so ma'am, do you have any special news from Ajinorah to convey to our viewers?
I think we have an unlimited offer for OET and IELTS.
Oh,
that OET is at 15,000. We have unlimited offer for until they pass the examination, as well as in IELTS at 10,000. They can continue their course until they pass the exam.
Oh, that will be a great news for all OET and IELTS aspirants, I think. And also, as we already mentioned, every day in Ajinorah is a beautiful day, and also in order to add some extra sweetness to our happiness, we do have some special news from our side, that is our OET results for April 15 is out, and our candidates have got 100% results on that. And in this time we do appreciate and congratulate all the candidates who had worked hard on their results, and also we do appreciate our trainers who have really trained and motivated them, because all of them needs a big salute on their part, because once again we would like to congratulate all of them. You have done a great job, and I hope we have almost completed all the details, introduction, and so shall we start to our session?
Yeah, ma'am.
Okay, so before proceeding to further, I'll be giving some brief introduction regarding this reading part, and I think it is total basic level of information, and so before proceeding to in depth, we'll give you some introduction regarding this reading OET in reading, that is as we already know, reading has three parts, that is part A, part B and part C, and we usually tell our candidates that part A is the easiest session, and but the timing for that is really crucial, that is we will be getting only 15 minutes to complete those 20 questions, and the question sessions in part A is divided into three, that is first type is 1 to 7 questions, which is called as locating type or matching type, and also next comes 8 to 14 questions, that is answer with short phrases or words, then comes 15 to 20 or 16 to 20, that is sentence completion type or fill in the blanks type, and we do have 4 short extracts on a single healthcare topic on part A, and as we already told, we have total duration of 15 minutes to complete that, and also we get 20 questions in that time, and for part B and C together we do have 45 minutes, and the task in part B and C is called as careful reading task. Why do we call it as a careful reading task is because this needs our in-depth knowledge, and we need to concentrate on that each of the words and sentences in detail, so that we will be getting an enough idea regarding what they are trying to convey. So all of this part B and C questions needs detailed reading and also a careful reading. That is why part B and C is together called as careful reading task, whereas part A task is called as expeditious reading task. Why? Because it only needs a random reading, and the method that we use in part A is skimming and scanning. There is no need of in-depth understanding about the content, and just the thing we want us, we need to just locate the keywords, and through that we can easily find the answers. Am I right, ma'am?
Yes, ma'am.
Yeah, okay. So the method that we follow in B and C is that called as elimination method, and I hope it is it is clear for you, and but many of our candidates are unaware about the questions that are contained in part C. So as we already know, we do have 2 extracts or text in part C, that is text 1 and text 2, and it will be related to a single healthcare topic, and we do have 8 questions each, and together of 16 questions in part C. So this also needs an in-depth understanding and also reading. So that's why it is called as careful reading task, and we should understand in detail information and understanding what they are trying to convey through those contents. So I hope it is clear for you all. And the type of questions which is included in part C are opinion type of questions or suggestion type of questions and lexical question, and the last one is complex phrase questions. Exactly. So these are the 3 types of questions which is consisted in part C other than the normal type of questions. I hope so far it is clear for you. So that's all about the brief introduction regarding part C. So today, so ma'am, could you please tell to our viewers, so what is our topic of today's session?
Okay, so today's topic is tracking down the puzzle in OET reading part C.
Yeah, exactly. As we already told, many of our students are having a frequent concern from their side that part C is really tough for them, and we are not able to score good, and it is we are not able to understand the meaning, and time is not enough for them, and so and so. So I hope, we hope that these sessions will be very grateful for you, and also it will help you to acquire more skills and also score good marks on your sessions. So I hope so far we are clear for you, and let's check our comment section for any opinions from the candidates.
Good afternoon, Alvin sir.
Good afternoon, Arvind sir.
Hi, Agnes.
Good afternoon, Marin. Good afternoon, Aksa.
Good afternoon, Jisha.
Hi, Nidhu ma'am.
Hi, Christina ma'am.
So we can start into our session, right?
Okay.
So we can display our presentation on the screen. I hope all of our viewers can see our screen. And we are planning our today's session in a question answer and in a discussion manner, so that you can comment your answers down there on the comment box, and we will be discussing together. So it will not be a boring session for you all. As we know, it is an afternoon session and all will be in a sleepy mode. So try to be active and try to interact with the session, and comment your answers down there on the comment box. So our today's topic is tracking down the PESIL in OET reading part C. So let's move on to our questions, and we have chosen official reading material, that is and we will be dealing with some questions, and you can share your answers in the comment. So about the first question, and
The main heading is allergic to eating.
Yeah, our topic is related to allergic to eating, and our first question is: the case of Lucy Smith highlights the fact that food allergies, and we do have 4 options, and I missed one thing, that is the main difference between part B and part C is, I know everyone will be telling that, that is in part B we will be having a short text, a word limit of 100 to 150 words, and we will be having only 3 options for that, and the questions will be mostly it will be an open-ended questions, and they will be asking for a suggestion, or like what is this
Meaning
extract is emphasizing about, or what is this, what they are telling us important. It will be an open-ended question always. And but in part C they will be pointing on to something, or as we already told, there can be a lexical type of questions or complex phrase questions, and maybe they will be asking for the opinion or suggestion what the author is conveying in the paragraph. So those are the some of the common questions that can come in part C. So our first question for today is: the case of Lucy Smith highlights the fact that food allergies. So they are focusing, or they are they need some highlight. They are asking for the main focus. So we can go to the options. Option A is may be difficult to diagnose in certain people, and B option is are relatively rare in adult population. The C option is can cause debilitating symptoms, and option D is often require urgent treatment. So these all are the options for this question, and we already know the method that we follow in reading part C and B is elimination method. And there is also some mistakes that usually candidates follow, that they will be separating soon after when you are reading the options, they will be thinking that this can be the answer. So they will be categorizing that answer might be the right one. So don't go in that way. Try to eliminate all those options and try to find the right answer. So and also in reading part B and C, everyone will be following in different ways. That we will be reading the question first, then maybe most of the students will be reading the options first, then moving on to the passage. Or some other candidates will be reading the passage first, then going to the options. But it's up to you, and according to your comfort you can follow whichever method which is appropriate for you and in which you can score good scores. So in this method, but try to follow both methods. That following one method will not be always appropriate. Like in different questions, while you are reading the question itself, if you are able to understand the general thing or the gist from that question, you can either read the question first first, or either read the passage first or the option first. It's up to you, and try to like intermittently follow those methods in different questions. So we have read the question and also the options. So ma'am, could you please help us with that passage?
Yeah, of course, ma'am. So the passage is Lucy Smith was strolling through Canberra last July. Within moments, she couldn't stand, gripped by pain so severe she feared she would pass out, the first sign of paralyzing diarrhea. This dramatic episode turned out to be caused by a newly acquired food allergy to red meat. Food allergies affect 1% of the adult population of Australia. Most don't hit with the same force as Lucy's, but the physical and mental impact can nonetheless turn a person's life upside down and may even be life-threatening. Lucy deduced that she was allergic to red meat, one of the less common allergenic foodstuffs. Only after several further attacks of varying severity was her suspicion eventually confirmed by a specialist. So that's the passage.
So that's all about the passage. So anyone from our candidates or viewers are commenting the options?
Sidram is answered option C.
Okay.
Okay, we will give a couple of times to answer the question.
So our option A is may be difficult to diagnose in certain people. So option A says that this condition or food allergies may be difficult to diagnose in certain people. So ma'am, could you find anything related to that option on this passage?
Ma'am, I think I don't see anything related to difficult to diagnose in certain people.
Yeah, there is nothing related to diagnosing or something. So the thing is, the option A, that is diagnose in certain people, which can be directly eliminated. Why? Because there is nothing mentioned regarding that option. And we do have an option from answer from Anita, that is answer can be C. So let's see what can be the answer. And our option B is are relatively rare in adult population. So we can say that they are saying that it is rare in adult population.
But ma'am, I see that food allergies affect 1% of adult population of Australia.
So whether that can be the answer or something?
No ma'am, I don't think so.
So because food allergies affect 1% of the adult population of Australia. So but they are giving some another information in this option, that is they are relatively rare in adult population. So they are not focusing any point of percentage or anything in this option. And the C option is can cause debilitating symptoms. So ma'am, do you have any idea that is what does this word debilitating means?
I think it's life-threatening, or it's any disease condition or infection may affecting some kind of complications.
Yeah, exactly. So the word debilitating means any condition or any disease condition which can make a person very weak. So that person will be feeling very weak, or maybe any life-threatening or any condition. So anything related to this debilitating symptoms can be seen on this passage?
Ma'am, I think I have seen that physical and mental impact can nonetheless turn a person's life upside down and may even be life-threatening.
Yeah, it is life-threatening. And our question is they asking about Lucy Smith, about that case about Lucy Smith, and what they are highlighting in the case of Lucy Smith's case. So about her, from almost here we can see that they are telling about Lucy and about but the physical and mental impact can nonetheless turn a person's life upside down and may even be life-threatening. So we through that sentence itself we can understand that by this there can be some another fatal complications or signs and symptoms which can be very life-threatening for that person. So there can be a chance for this can be the answer, yes, right ma'am? Yes, so let's see, we can apply this elimination on the option D also. Often require urgent treatment. So only the thing which can be related to the treatment can be this: only after several further attacks of varying severity was her suspicion eventually confirmed by a specialist. But they are not telling that this condition does require an immediate attention or urgent treatment or anything. So from that we do understand that option A can be they are mentioning nothing regarding this diagnosis, and they are mentioning nothing regarding this. It is really rare among the adult population, so we can eliminate that also. And option D is often require urgent requirement, which means there is nothing they are telling or depicting regarding it means, and it needs an urgent treatment or urgent attention or anything, so we can eliminate this option D too. So that answer can be option C.
Okay.
I hope it is clear for everyone.
Ma'am, one thing is I think they are using some synonyms as life-threatening to debilitating.
Yeah, yes, exactly. So there can be a synonym that is life-threatening and debilitating. So almost the meanings are really similar to each other. So we can say that it is a synonym type of option, and we can see that question word and the passage word, that is question word is debilitating and the passage word is life-threatening. So we can confirm that the answer is C, and many of our students have given their comments as C too.
C.
And
B also.
yeah, there can be a like confusion, but when we are trying to understand the meaning, and we can confirm that the option can be, the answer can be C. And I congratulate all those who have answered the correct one. So ma'am, can we move on to the next question?
Yes, ma'am.
Yeah, okay, on to you, please proceed.
Okay. So the second question is, in the second paragraph, what point is made about food intolerance? Okay. So the options, as we know, there is also four options is the option A, scientists continue to disagree about their root causes. Option B, the symptoms are indistinguishable from those of allergies. Option C, they can have unpredictable impact on the persons affected. And option D, the distinction between them and allergies is not widely appreciated. Okay, so I think we have to give some couple of time to answer the question.
Yeah, in that time we can read that passage. Okay. So our passage is about an allergy. According to immunologists, is the immune system overreacting to a substance that would ordinarily be considered benign. However, the term allergy is used more loosely by the general public. People say they are allergic to a substance because it brings about some kind of adverse reaction in their bodies, some of which can be severe and may resemble true allergic reaction. But unless the immune system itself is directly involved, experts categorize it as intolerance. Constant sneezing, itchy eyes or throat or inner ears, asthma, rashes and diarrhea can all be the signs of food allergies. Intolerance can bring on similar warning signs as well as things such as headaches, bloating and general lethargy. Over time, some allergy sufferers lose weight because there are so few foods they can eat. Of course, the social implications are huge too. Eating is major social event. So that's all about the passage. So we can see whether any of our viewers are giving the answers.
Okay, so ma'am, have you find out the answer from this passage? Have you understand what the point mainly they are saying regarding food intolerance?
Actually, the passage is fully telling about this allergy and about this immunologist and like what they are predicting or what they are referring to this allergy, or what this allergy could be, and what are the symptoms and signs which a person will be having when they are encountering with an allergy. So ma'am, could you please eliminate these options for these candidates?
Okay, fine. So I think the keyword is food intolerance and the point. What point? So we have to identify what is the main thing that is given in the given regarding food intolerance in this passage. So I think we can read again the option. So option A, scientists continue to disagree about their root causes. So have you read anything regarding the root causes and the disagreement about the scientists?
No, I think I couldn't find anything regarding to that.
Okay, so we can directly eliminate option A as the wrong answer. Option B, the symptoms are indistinguishable from those of allergies, which means that the symptoms of food allergies and food intolerance is indistinguishable.
Okay.
So we can remain that option. Option C, they can have an unpredictable impact on the person affected. So from this passage they are not telling about the impact of food intolerance in person affected. So I think we can directly eliminate the option C.
Yeah.
Okay, so the remaining last option is option D. The distinction between them and allergies is not widely appreciated. So what do you mean by distinction?
Like a kind of separation or anything?
Yeah, ma'am. So the distinction between them and allergy is not widely appreciated. So the food allergies and food intolerance is having some similar warning signs. From this passage itself, they are clearly given that it has intolerance, constant sneezing, itchy eyes or throat and inner ears, asthma, rashes and diarrhea can all be signs of food allergies, and intolerance can bring on similar warning signs as well as things such as headaches, bloating and general lethargy. So from these similar warning signs, which means the food allergies and food intolerance have some kind of similar warning signs. So I think D might be the answer.
Yeah, according to your words, I can understand that there is a close similarity between D and that sentence that you have told.
Yeah. So most of the students answered as option B. Some of the students are option D, answered option D. Okay, so the correct answer is option D. The distinction between them and allergy is not widely appreciated. Why? Because they are clearly given that the food intolerance and food allergies have some similar warning signs, which means that the distinction between them and allergy is not widely appreciated. So that's why option D is the correct answer, and we can eliminate option B. The symptoms are indistinguishable from those of allergy, so they are clearly says that they have some kind of similar warning signs, so we can distinguish them with food allergies and food intolerance with the symptoms. So the correct answer is option D.
And many of our students have given the answers as option D too.
Okay.
So ma'am, shall we move on to the next question?
Yes, ma'am.
Yeah.
Okay. So the next question is, the phrase via different biological mechanism in the third paragraph explains. Okay, so I think it's a complex phrase question, isn't it?
This type of questions we have already seen that there can be a complex phrase questions too.
Okay, so the options are option A, the way the skin prick test works in diagnosing food intolerances. Option B, how the presence of food impurities impacts on the skin prick test. And option C, why the skin prick test may not accurately diagnose food intolerance. And the last option, how food allergies are triggered by substances used in the skin prick test. So I think from these options we can understand that this passage is some kind of related to some kind of test called skin prick test. So ma'am, could you please read the passage?
Yeah, sure ma'am. To diagnose a food allergy, immunologist uses skin prick test in which a drop of commercially extracted allergen is placed on the skin and the first couple of skin layers are pricked with a lancet. If a person is allergic, the immune system is stimulated sufficiently to produce a mosquito bite-like bump within 15 minutes. This testing method is, however, somewhat unreliable in detecting intolerances because while not fully understood, they operate via a different biological mechanism, possibly involving chemicals in food irritating nerve endings in the body. They are generally diagnosed by following an exclusion diet in which suspect foods are gradually reintroduced and their effects monitored.
So I think we have to locate the phrase via a different biological mechanism. So what do you mean by this passage? What is the summarization?
As you already told, they are telling something regarding a test that is called a skin prick test. So we can choose this skin prick test as our keyword in this option, right?
Okay.
So we can see in option by option, that is our first option is
the way the skin prick test works in diagnosing food intolerances. So ma'am, have you seen anything related to the skin prick test works in diagnosing food intolerance?
No, I think there is nothing telling regarding this diagnosis and all.
Okay. And the second option, how the presence of food impurities impacts on the skin prick test. So they are not mentioned any food impurities impacts on the skin prick test. So we can eliminate option A and option B.
And then comes the option C, why the skin prick test may not accurately diagnose food intolerance.
So let's see the phrase here. This testing method is, however, somewhat unreliable in detecting intolerances because while not fully understood, they operate via a different biological mechanism, possibly involving chemicals in food irritating nerve endings in the body. So let's wait some more times to answer the question. Candidates, please answer and cooperate with us to answer the question.
Yeah. So ma'am, do you have any comments from our candidates?
Okay, so most of the students are answered as option C.
Yeah.
And some of the students answered as option A. So option C, why the skin prick test may not accurately diagnose food intolerance. So here, somewhat unreliable. What do you mean by unreliable?
Which cannot be like trusted, or which cannot be like well understood.
The exact, they are not sure about the exact meaning of the different kind of food detecting intolerance. So this testing method is, however, somewhat unreliable in detecting intolerance, which means they are not accurately confirm the food intolerance diagnosis. So there may be chance that not accurately diagnose food intolerance. So the option C, why the skin prick test may not accurately diagnose food intolerance. So there may be chance as the option C is the answer. We can read the last option also. Option D, how food allergies are triggered by substances used in the skin prick test. So I think they are not mentioned any triggering factors to the skin prick test. So I think we can also eliminate option D as the wrong answer. So option C is the right answer, that why the skin prick test may not accurately diagnose food intolerance. So from this synonym unreliable, they are choosing unreliable to synonym as the not accurately diagnosed.
So ma'am, we have already told that there is a synonym type of questions also in part C. So I hope this type of question is clear for you all, and we can see that the same word, that is not accurately, that is in the passage it is told as unreliable. So as I will always suggest my students to keep a page on your last page of your reading book, to keep an account for the question words and also passage words which will be having the synonymal meaning, so that you can understand, so that there will be some repetitions in the part C also, so you will be able to understand the similar questions when it comes again and again. So I hope this will be helping for you. So we can confirm that this answer is C,
option
right?
C,
and many of our students have given this right answer, that is Atul, Marin, Meenu, Nikhila all have given the same answer, that is option C. And good to know that. And so ma'am, shall we move on to the next question?
Yes.
Okay.
So the next question is, Dr. Sauter uses the image of fireworks factory to illustrate that. So I think this passage is mainly given as Dr. Sauter, Valencia Sauter. So he explains some kind of things related to the food allergy. So we can move on to the options. Okay, so option A, the factors triggering an allergic reaction still remain unclear. Option B, allergic attacks can occur suddenly any time in a person's life. Option C, it's difficult to foresee which family member an allergy will affect. And option D, the identification of a food allergy is basically a matter of chance. So that's end of the options. So
ma'am, when a question comes like this, so could you please tell me, we have to look those area in the passage that whether a person's name can be there. So we need to focus only on that area, right?
Yes ma'am. So we need to focus the Dr. Sauter. So we need to identify what is the author or what is the scientist tells regarding from this passage regarding this meaning.
Yeah, maybe this passage is on this question our passage is really short, but in some cases we will be having a bigger or longer passages in which you will be looking onto each of the sentences and you will be trying to understand. And as you already know, this part C text is really tough to understand. Why? Because maybe we will not be getting an idea whether each of these paragraphs are closely related or not, because they will be giving different information, and it will be very difficult for us to understand all it in a glance. So maybe without reading into each and every words of that, we can focus on Dr. Sauter, or where that person's name is depicted. So we can focus only on that area, so we will be able to identify the answer very well, and we will be able to score good. So,
and also I have a solution for that. That after reading the passage, we need to understand the meaning, or we need to summarize what is the thing that given in the passage in our mother tongue. So that will help to improve our learning capacity from the passage, and we can able to answer the question more easily.
Yeah, ma'am, that is a really good tip for our candidates, because trying to understand each of these words and sentences in our own mother tongue will be very helpful for us, because as we all are having our own mother tongue, we will be having like a much more difficulty for all our candidates. If each of this English word is explained in Malayalam, it will be very easy for them, and they will be very happy on that. So according to that, or based on that idea, you can translate all of this content into your own mother tongue, so it will be very, very easy for you. So let's move on to the passage. In that time, candidates are requested to go through the question, and also you can answer those answers in their comment box. So our passage is, according to pediatric immunology specialist Dr. Valencia Sauter, around 6 to 8% of babies are affected by allergy, while most children will outgrow them. Some actually grow into them. The mechanism that provoke an allergy remain a gray area. Sauter says it's like throwing a match into a firework factory. Hit the right place and you set off a chain reaction. Miss it and match just fizzles out. This difference between lighting up or fizzling out isn't well understood.
So I think from this passage, the Dr. Sauter says from relation with unrealistic situation with food allergy. So the Dr. Sauter explain the meaning of food allergy, or the situation of food allergy, to something unrealistic situation. So we can focus the word or the sentence fireworks factory. So here the mechanisms that provoke an allergy remain in gray area. Sauter says it's like throwing a match into fireworks factory. So do you know anything regarding this passage, or are you able to summarize the passage?
Actually, this Dr. Valencia Sauter is similarizing or familiarizing this instance or about this food allergy into something that is matching a firework factory, and he's confusing with this setting a reaction and also fizzling out, and lighting up and fizzling out. So he's saying that there is a difference between those two, and I think I understood that much thing. So ma'am, could you please help with this?
Okay, so we can move on to the options. Okay, so the first option, the factors triggering an allergic reaction still remain unclear. So the factors triggering an allergic reaction still remain unclear. Okay, so I think there might be chance for option A, because the factor triggering an allergic reaction. So from this word fireworks factory, match into a firework factory means there are some provoking to the allergic reaction. So from the passage itself, they clearly given that the mechanisms that provoke an allergy remain a gray area. So I think provoke is a synonym for triggering.
Yeah,
so,
exactly.
Okay, so that might be the answer. Option B, allergic attacks can occur suddenly any time in a person's life. So from this passage, they are not mentioned about the allergic attacks can occur suddenly any time in a person's life. So we can directly eliminate option B as the wrong answer. And option C, it's difficult to foresee which family member an allergy will affect. Ma'am, have you seen anything related to which family member is prone to allergic reaction?
Like when I read this passage, and other than this babies and all, there is nothing related to this family and anything. So I think we can directly eliminate this because it is directly indirect.
Yeah, so we can directly eliminate option C also. The passage, they are not mentioned about the which family members is prone to allergic reaction.
Yeah.
So the last option, the remaining option, the identification of a food allergy is basically matter of chance. So is there any thing related to identification of food allergy? Have you seen anything else?
No, ma'am. I can't see anything.
Okay. So I think we can directly eliminate option D also. So the remaining option is option A. The factors triggering an allergy reaction still remain unclear. So they are using a synonym that provoke as triggering. So I think option A is the right answer, and most of the students are answering option A. So thank you all of you to answer the right answer.
Yeah, many of our students are Meenu, Pushpa, Anita,
Yeah.
Sneha, Alfie all have given the right answer, that is option A. And ma'am, your trick of answering this is really wonderful. That is, she as you have already seen, that she is finding some synonymal words from the passage as well as from the question and also from the options, and trying to relate each with it, and likewise we can find the answer. And this is one of the effective way in which you can approach part C very easily.
So in this question, option A is the answer.
Yeah.
So shall we move on to the next
Yeah,
question?
sure, ma'am.
Okay. So the next question. In the fifth paragraph, what point is made about the two hypotheses mentioned? So from this question, we need to understand that there will be a two hypotheses. So we need to directly focus on the two hypotheses mentioned in the passage. So the options are: option A, they both appear to be credible; option B, they directly contradict each other; and option C, they fail to define their terms adequately. The last option, they should both be studied in more depth. So ma'am, could you please help us to
Yeah,
read
sure,
the
ma'am. My
passage?
pleasure. Broadly speaking, Dr. Sauter says that the ideal recipe for a food allergy is to be born of allergic parents and then to have a high risk to an allergenic foodstuff. But there are so many exceptions to this rule that other forces are clearly at work, and who's to say what high exposure is anyway. In contrast, the so-called hygiene hypothesis suggests too low an exposure to allergens is to blame. The idea is that today's clean environments leave our immune system with too little to do, encouraging them to turn the wrong culprits. Clearly, the field of immunology has only just scratched the surface of understanding.
Okay, thank you ma'am for reading the passage clearly. So I think we have to give some couple of time to answer the question. Betty Jomi answered as option A. Sidram answered as option B. Maria Sabu, option A. Okay, so let's discuss the options with the passage. Okay, so I'm already said we need to focus two hypotheses mentioned in the passage. From the passage itself, they are clearly given two hypotheses related to food allergy. So we can move to the options. Okay, the option A, they both appear to be credible. So the two hypotheses are, they are given. Dr. Sauter says that there is an ideal recipe. Dr. Sauter find a ideal recipe for the food allergy. So what do you mean by ideal recipe?
Maybe a satisfactory solution.
Okay, so thank you ma'am. So ideal recipe means Dr. Sauter says food allergy as an ideal recipe to prevent the food allergy. So the first hypothesis is food allergy is to be born of allergic parents and then to have a high exposure to an allergic foodstuff. But there are so many exceptions to this rule that other forces are clearly at work, and who's to say what high exposure is anyway. The first hypothesis means a person is born of allergic parents and they need to expose some kind of high exposure to allergic foodstuff. So that may be the solution for preventing the food allergy. And the second hypothesis, in contrast, the so-called hygiene hypothesis suggests too low an exposure to allergens is to blame. The idea is that today's clean environment leave our immune system with too little to do, encouraging them to turn on the wrong culprits, which means nevertheless the clean environment which will reduce the chance for food allergy. So there are the two hypotheses. So from the options, they both appear to be credible. So from this passage, if they are not given any kind of signs of credible of both hypotheses, so we can directly eliminate option A as the wrong answer. Next option, they directly contradict each other. So contradict, what do you mean by contradict?
Opposite or contrary?
Yes. So from this option, they directly contradict each other. So the passage itself, they are clearly given that in contrast, the so-called hygiene hypothesis suggests too low an exposure to allergens is to blame. So in contrast is also a synonym for contradict. So I think they are paraphrasing the option with the sentence. Okay, so I think B might be the answer.
There
for
can
this
be
question.
a possible chances for that.
Yes, the option C, they fail to define their terms adequately. So from this option, we can directly eliminate option C because they are clearly given that. Clearly, they failed of immunology. So they clearly identify the both two hypotheses. So from this option, they fail to define their terms. So we can directly eliminate option C also. The last option, they should both be studied in more depth. So the last sentence in the passage is clearly the field of immunology has only just scratched the surface of understanding. So the students may confused with the option D because the last sentence is something related to in-depth study or thing, but they are given that the study of immunology is only on the base of the study, which means scratch the surface of understanding, which means only the base of the study. So we can,
that is what they have already done based on that hypothesis. That sentence means that like they have only done the basic level of investigation or understanding on that. So it doesn't mean that it needs to be studied in more detail because they are not telling anything regarding that.
So from these options we can eliminate option D. So the remaining option is option B, they directly contradict each other. So here again they are using a synonym with contrast and contradict. So they directly contradict each other is the answer for this question.
So the question word and the passage word is, and from the passage we can understand that in contrast they have given as in contrast, that is opposite to that, and in the option it is they directly contradict each other, that is the two hypotheses are exactly different from each other. So from that single word itself we can directly focus into the option B, and many of our students have given that answer.
So I'm very happy to see that most of the students are answered the right answer, option B. So
Abdul Marin Meenu, very good, you have answered it correct. And don't worry for others, and you will be getting it. And shall we move on to the next question?
Yes, ma'am.
Okay. So this question, what does the phrase "this rule" in the fifth paragraph refers to? So this is a lexical type of question, and in this we can understand that the same passage, earlier we have discussed the same passage, and in the paragraph or in the fifth paragraph this rule phrase is referred to, or what does it mean in the fifth paragraph? And the option says is the likelihood of having an inherited allergy to certain foods, and option B is the type of diet in which food allergies more commonly occur, and the degree of contact with allergens needed to trigger a reaction, and the order of events most commonly found prior to allergic attacks. So we have to find this rule. What is this rule in this passage is telling about, or what they are referring to. From that option A, we can choose as this inherited allergy as our keyword, and next is this type of diet from this option B, and next is the degree of contact with allergens needed to trigger a reaction. So we can choose degree of contact as our keyword from option C, and next is the order of events. So they are telling about some like step by step events or one after back to back events. So ma'am, could you please help us with this passage?
Yeah, ma'am. Broadly speaking, Dr. South says that ideal recipe for a food allergy is to be born of allergic parents and then to have a high exposure to allergen in foodstuff. But there are so many exceptions to this rule that other forces are clearly at work, and who's to say what high exposure is anyway? In contrast, the so-called hygiene hypothesis suggests too low an exposure to allergens is to blame. The idea is that today's clean environments leave our immune systems with too little to do, encouraging them to turn on the wrong culprits. Clearly, the field of immunology has only just scratched the surface of understanding.
Yeah, thank you ma'am, thank you so much. So we can see what is this actual meaning of this passage that we have already discussed regarding this passage on the earlier question, and we can see this rule in the passage here, and the answer can be from this area to this area. Let's see. Broadly speaking, Dr. Sauter says that ideal recipe for a food allergy is to be born of allergic parents and then to have a high exposure to an allergenic foodstuff, but there are so many exceptions to this rule. So exceptions means there is some dissimilarity or some difference, that other forces are clearly at work. So we can understand that from other than this two, that is born to allergic parents and also higher exposure to this allergenic foodstuff, there are some exceptions, and also we can understand this there are some exception in this rule that other forces are clearly at work, which means there are some another factors which may be included in this. And then comes, and who's to say what high exposure is anyway? That means there's something is unclear there. So we can say our first option is the likelihood of having an inherited allergy to certain foods. So in this area, whether any one of you can see anything regarding this inherited allergy, so maybe everyone will be confused here, that is an ideal recipe for food allergy is to be born to allergic parents. So ma'am, we have already said that ideal recipe means what?
It's satisfying
Any satisfactory solution. So Dr. Sauter is providing us a satisfactory solution, that in order to get away from this allergenic foodstuff or food allergy, what can be done? That is, if a person is born to an allergic parent, and if that person is like having a higher exposure to allergenic foodstuff, there can be a lower chance for having a food allergy. So that is recommended by this Dr. Sauter, and there is an exception in this case. So they are telling one by one something else. So there is an exception in this case, and that there are other forces that may clearly work on this. That is, there are some other factors which may be included in this. So our first option, they are telling about inherited allergy, and we can say nothing regarding this inherited allergy. So our keyword itself is not there on the passage. So we can directly eliminate this first option. So next, B option is the type of diet in which food allergies are more commonly occur. So there is no need of referring the passage again. They are not telling any type of diet or what are the foods that you can include or what are the foods that you can exclude or anything. So we can directly eliminate that too. So next is the degree of contact with allergens needed to trigger a reaction. So have you seen anything regarding that? Any degree of contact with that allergic foodstuffs?
But ma'am, the students may be some confusion related to clearly at work and who stay at high exposure.
Yeah.
So the high exposure, which the students may make some confusion, degree of contact, but they are not mentioned about the degree of contact. They are saying high exposure.
Yeah, when we are comparing all these options, so if you are having any doubt regarding that option, keep it apart. We can keep it apart, and then we can move on to the D option, that is the order of events most commonly found prior to allergic reactions. So they are asking what this rule is emphasized in, or what is this rule is meant in this fifth paragraph. So we need to find the meaning of this. What we have to find this rule's meaning in this paragraph. So they are telling that if a person is born to allergic parents, and we have a word that then too, then 2 later on, and then comes have higher exposure to allergic events foodstuff, but there is an exception, there is another possibility. So they are telling about something in a step by step manner, that it can then be then, which means there is a later on reaction, or later on something is coming back. So we can say that there is a more probability that order of events, there is a more order of events, and when we are reading it together, but there are so many exception in the order of events most commonly found prior to allergic reaction, that other forces are clearly working on it. Maybe there are some other factors can also contribute on that. So that option can be D, that is this order of events. I hope it is clear for you all, and let's see whether anyone has given the answer right.
GB Nijos, option D. Krishnendu, option D. Christian Grace, option D. So I think most of the students are cleared with the answer.
Yeah, I hope it is clear for you all. So let's move on to the next question. So next question is, what does the 6th paragraph suggest about the transference of allergies between mother and child? So we can understand that they are asking something regarding transference of allergies between mother and child. So there is a transferring of allergy between mother and child. So what they are suggesting about? So they ask for a suggestion. So we have already told that there is a type of question in part C, that is a suggestion type or opinion type of question. So in this case, there will be a thing which is called as modal verb. So modal verb is a thing in which when they are asking for a suggestion, in most of the cases, that is almost a 75% of cases, there will be in the option itself, they will be giving a suggestion, that is it may, it could, it should, and they will not be confirming anything. So it may be, it can be, so something they will be giving a suggestion, they are not focusing any something else. So from the options itself, without reading the passage, we can directly eliminate, we can see which all the things can be eliminated. So our first option is, it is only possible with particular individual. So they are confirming on something, it is only possible on particular individual. So they are focusing that it is only like confirming on something. So there can be a chance, but we are keeping it apart. Okay. We have already told that is modal verb. This chances of modal verb is 75% only. There is something extra. So we can see it can result in instance of malnourishment. So there is a modal verb. There is a possibility. They are giving a suggestion. So this can be answer. Then option C is it may be. So there is also a modal verb. It may be avoidable if certain precautions are taken. A particular thing can be avoided if some precautions or preventive measures are taken. So there is another suggestions given there. It is most likely to take place before the baby is born. So they are here also, we can say that they are confirming on something. It is more likely to take place before a baby is born. They are confirming on something. So we can keep this option A and D apart. And this modal verbal chance is almost, we have already told, it is 75%. So when you are getting a question like suggestion or opinion or anything, you can directly apply this format on that, and then you can refer on to your passage and then come to your final answer. So ma'am, could you please help us with this passage?
So interesting flakes of information are gradually being peeled off that surface. However, there is evidence that allergens can be transferred through a mother's breast milk to her child, and possibly also through the placenta. Since the immaturity of babies' immune systems might make them more vulnerable to an inherited allergic tendency, women in allergic families could be advised to avoid certain foods during pregnancy and breastfeeding. It is possible, though, that some allergies or intolerances are purely imaginary, and this can also have consequences. For children, one US study found that parents sometimes avoided foods to which they erroneously believed their children were allergic, occasionally leaving the children severely unnerved. So I think we need to understand the meaning of this passage.
Yeah. So ma'am, could you please tell me what can be the summary of this passage?
I think from the passage itself, they are telling that the mother and the baby, the occurrence of transference of food allergies to mother from the mother to the baby.
Okay.
And how we can prevent some such kind of things in the person of with allergy, food allergy.
Yeah, exactly. What ma'am told us exactly the same. And is there anything told regarding, or they are inferring regarding it is only possible with particular individuals? They are, if there are any confirming regarding this option A?
No ma'am, I think the passages for they are clearly given that mother and baby, the occurrence of transference of food allergies to from mother to baby.
Yeah,
They are not focusing any particular individuals.
yeah, okay. So there is no need of further explanations on that, so we can directly eliminate that thing. And option B is, it can result in instance of malnourishment. So they are telling regarding something regarding that children severely unfed. That is, at the starting, one US study found that parents sometimes avoided food to which they erroneously believed their children were allergic, occasionally leaving the children unfed. So they are telling about a US study. So our question is, what does the 6th paragraph suggest about the transference of allergies between mother and child? So whole of a paragraph, that is the 6th paragraph, all of it together, what they are suggesting. And about this US and also this underfed or malnourishment, they are only focusing on a single sentence, and we can't say it is the total summary of that paragraph.
So we need to summarize the paragraph.
We have to come into a general understanding from that passage. And first, so we can eliminate this option B also. And option C is, it may be avoidable if certain precautions are taken. That means this food allergy or the transference of allergy from mother to child can be avoided if you are taking any precautions or any preventive measures. So ma'am, is there anything related to that?
Yes ma'am, actually I'm seeing that here, immune systems might make them more vulnerable to an inherited allergic tendency. Women in allergic families could be advised to avoid certain food during pregnancy and breastfeeding, which means during breastfeeding and during pregnancy period, the mother need to avoid such kind of certain foods to avoid the food allergy.
As we already know, disease condition can be transmitted from a mother to child during this pregnancy and also this through this breastfeeding period. So in order to avoid this, women at this age group or the reproductive age group are advised to avoid certain kinds of food which can be causing this food allergies. So they are telling most of the things, or they are focusing mainly on this option C, so we can keep it. And next option is, it is most likely to take place before the baby is born. So is there anything related to that, or this food allergy can be, or transference can be taken place before this baby is born?
No ma'am, I don't see anything related to that.
So I hope everyone is on the same page, that so we can confirm that they are telling that they are suggesting that is transference of food allergy from mother and child can be avoided with use of some precaution measures or preventive measures. So we can confirm that our answer is option C.
I think
many of our students have given that option as C. So I can see that I hope everyone is clear with this. And we can move on to the next question. Dr. Sauter suggests that the rise in cases of one allergy may be partly due to. So here we are again encountered with a suggestive question. So in the later question, we have already seen that we have suggested a modal verb, that is can and maybe, and this maybe was our answer, that is a modal verbial answer. Option was our answer. So on the next question, let's see whether it can be something like that. Dr. Sauter suggests that a rise in cases of one allergy may be partly due to. So they are focusing on some issue. So option A is attempts to improve eating habits. Next is option B is changes in food manufacturing method. Next is option C is adoption of new agricultural practice, and option D is increased level of harmful substance in the atmosphere. That is harmful substance in the atmosphere. So ma'am, could you please help us with this passage?
Okay ma'am. So in Australia, the number of people with genuine and severe allergies is growing. Some doctors speculate whether the increased amount of new chemicals in the environment and in food is perhaps damaging immune systems, making them more prone to react adversely. Much more research need to be done to provide evidence for that hypothesis. Anecdotally though, some experts say that staying off processed foods resolves the problem in a significant number of cases. Dr. Sauter speculates that a rise in peanut allergy cases makes up the bulk of the increase in food allergies. Greater exposure has probably allowed more peanut allergies to flourish. She thinks peanut consumption per capita is rising. It's a common ingredient in Asian and vegetarian dishes, which have grown in popularity, and the diet conscious population is increasingly turning to nuts as a source of healthy fats.
Okay, thank you so much, ma'am. And next is in the later on questions, before 2 to 4 questions, we have seen that if they are focusing the question itself, they are focusing any particular person's name, there is no need of fully like going through each and every word other than this thing. So in this passage, we can anywhere. Can you see this Dr. Sauter anywhere? Yeah, it is. Here Dr. Sauter speculates. So there is no need of focusing on all of these things, because the question word, or they are focusing on Dr. Sauter, what he is suggesting or what he is saying regarding something. And the question is focusing on that particular person. So we can find this person's name from the passage and focus on that particular area, and you can find the answer. So first option is attempts to improve eating habits. So whether this Dr. Sauter is like providing some information or attempting some information to improve our eating habit, whether he is saying anything regarding that.
I think the Dr. Sauter says that rise in peanut allergy cases, some kind of studies he conducted, and he says some peanut allergy cases make up the bulk of the increase in food allergies.
Yeah.
So the people need to avoid such kind of allergies by avoiding such kind of certain foods.
Yeah, maybe this Dr. Sauter is focusing on peanut allergy only. He is now focusing on peanut allergy only. So we can keep that option apart. Next, option B is changes in food manufacturing methods. Have you seen anything related to food manufacturing or food production or anything in this passage? And I can't see anything related to that, and it's full about this conception and about its ingredients and everything, and there is nothing related to food manufacturing, so we can eliminate that option. And option C is the adoption of new agricultural practice, and we doesn't see our word agriculture in this passage, so we can directly don't think twice on that, we can directly eliminate that option. And option D is increased level of harmful substance in the atmosphere. So in the passage itself, we have eliminated all of this portion. Why? Because our focus point, that is our Dr. Sauter, starts from here. So no need of focusing on earlier sentences. But this increased level of harmful substance in the atmosphere, there comes here. Amount of new chemicals in their environment and food perhaps and everything, and they are telling about in Australia, and it is nothing related to Dr. Sauter. So is there any need on focusing that option D? Absolutely, there is no need of focusing on option D, which means the answer can be what? Option A, that is attempts to improve eating habit. He is focusing on peanut allergy, so if he is telling that increased consumption of peanut can be causing this food allergy, that is, it is a main cause of food allergy or something. So if you are making our food like food pattern or eating habits, it will be very helpful. That is the suggestion that which he is giving through this passage. So I hope that is clear for you all. So we have come to the end of our session. So if you are having any concerns regarding today's sessions, please feel free to comment on our comment section.
And raise your questions in the comment box.
We will be so much pleased to answer to your questions. I will wait for some time. You can give our feedbacks, and you can give about your concerns, questions or doubt. We will be very much happy to give clarifications to you. So we hope this was a wonderful session, and we also enjoyed for being together with you. I hope you all have enjoyed it, and also you have understood something from our session. And let me remind you once again that we do have an unlimited package for OET and for IELTS
yes.
too. That is, you will be having an opportunity to take part in this package. That is, you will be for OET it will be available only at 15,000. That is, you are able to
Continue
the studies until you pass. And also for IELTS you will be, the classes are available only at 10,000, and you can continue the same until you pass. And I think it is a good opportunity for you all, and all for the all IELTS and OET aspirants. And I hope you will utilize this opportunity. And this I think this session was very helpful for you. And thank you for being with us so far. And before concluding, we would like to thank all the technical team who worked behind this, and throughout the session they helped us to continue the session without any interruptions. And also for all other academic staff and candidates who have watched this and encouraged us and motivated us. And thank you so much for watching us. And we will be again sooner on the same platform with another live session, which will be very helpful for you. So today we are signing off, and thank you.
Thank you.